Good afternoon, everyone. Welcome back. I'm Steve.
And I'm Scott.
Together, we're Backyard Musings, broadcasting in Apple Valley, California, People's Republic of California.
Yep, and this morning we were talking about B12 and its connection with cognitive decline, and now we're going to talk about liver disease. So It's a medical day.
More than 1 in 3 people worldwide live with metabolic dysfunction-associated steatotic liver disease. That's MASLD. More than 1/3.
It's a lot.
Making it the most common chronic liver condition across the globe. Patients with chronic liver disease, MASLD, who also have high blood pressure, prediabetes, or diabetes, or low HDL cholesterol, face the greatest risk. Would you like to know more?
This disease develops when excess fat accumulates in the liver and is linked to one or more of 5 health issues: obesity, type 2 diabetes, high blood pressure, high blood sugar, and low HDL cholesterol, often referred to as the good cholesterol, HDL, right? Collectively, these issues are known as cardiometabolic risk factors because they influence both heart health and metabolism.
Left unchecked, MASLD can progress to severe complications, including advanced disease of the liver, heart, and kidneys. However, researchers have only recently begun to investigate whether certain cardiometabolic risk factors increase the likelihood of death more than others in people with this condition.
Now, a new study from Keck Medicine of USC, I'm going to assume that that's University of Southern California, right? Published in Clinical Gastroenterology and Hepatology, on September 17th, 2025, reveals that 3 of the cardiometabolic risk factors carry the greatest risk of death for those with MASLD: high blood pressure, prediabetes or type 2 diabetes, and low HDL, which raise the risk of death by 40%, 25%, and 50% respectively.
Dang.
That's a lot. These results were independent on how many of which combination of cardiometabolic risk factors patients had, and held steady despite individuals' gender, sex, race, or ethnicity.
I thought gender and sex were the same thing.
Well, I would agree with you, but I don't know why they threw that in there. But if we're talking about USC, it's probably a little left-leaning university.
So is it different for two-spirit people?
Did you hear that deal with Josh Hawley?
Yeah,
he was really getting on that guy, man.
I don't know what it is. Well, you wrote the paper.
And he never got an answer.
No, he never got an answer. Quote, MASLD is a complicated disease, and this study sheds new light on where doctors may want to focus their efforts when treating patients, said Nora A. Turow, medical doctor, a hepatologist with Keck Medicine, and a senior author of the study. Continuing the quote, knowing which aspects of MASLD might lead to poorer outcomes can help us offer patients the best possible care.
Researchers were especially surprised to discover that high blood pressure was associated with a higher chance of death than diabetes, said Matthew Dukwich, MD, PharmD, I guess, what is that?
Pharmacy.
MS, a USC transplant hematology fellow and health author of the study, or lead author of the study, sorry. Quote, until now, it was commonly thought that diabetes was the most pressing health problem for MASLD patients, which is a key insight.
Okay. So this guy's got a medical doctor and a pharmaceutical doctorate. So I'll bet if I were him, I'd want to work in a pharmacy, less hours, right? You don't have to work 70, 80 hours a week as a medical doctor. Dang.
Well, obviously a guy with all those bona fides next to his name. Those are he's an overachiever, right? So he's probably, unfortunately, probably doesn't have much family life. So,
Yeah.
but if he's working for this thing and trying to get to the bottom of this MASLD, this is great.
Yep. The study also found that obesity, the most common cardiometabolic risk factor of MASLD, can substantially raise the risk of mortality depending on a patient's body mass index, which is a formula used to estimate body fat percentage based on an individual's height and weight. We know about this being in the Army. You know how Pete Hegseth said you can't be fat?
Well, just talking about that. Yeah, he was just talking about that.
So they tape to find your body mass index in the military. And if you fall out of that, you get warned. If it happens again, you get separated from the armed forces.
Separated as in let go?
Let go. Yep.
Wow.
The higher a patient's BMI, the higher the association with death.
So that's you only get 2 chances. You either get it straightened out the first time, the second time you're tested, you're gone. Wow. Okay.
Yeah, well, it depends on the command because you get flagged. So when you get flagged, there's no favorable actions that can happen. You can't get awards. You can't get promoted. You're just stuck in a rut. You can't go anywhere. So if you haven't improved by the second one, then you're out.
Wow. Take it seriously.
Yeah.
Okay. So additionally, the research adds to the growing body of research that patients with more cardiometabolic risk factors have poorer outcomes. The study found that the risk of death in MASLD patients increased by 15% for each additional cardiometabolic risk factor present. Okay.
Researchers used data from the National Health and Nutrition Examination Survey, which collected health information about children and adults in the United States from 1988 to 2018, the most current year for which data were available for the study. Out of 135,000 participants 20 years or older, some 21,000 patients qualified as having MASLD. What?
That's what?
15%.
15, 20%. Yeah.
Well, at least it's not 1 in 3. So the study authors tracked all-cause mortality rates by individual cardiometabolic risk factors to reach their conclusions. So this was
still a lot, though.
Was it?
That's a lot.
Yeah.
And the age, 20 years or older.
Yeah.
Wow. Okay. Looking ahead, the study authors hope to conduct further studies examining patients' genetic background, dietary habits, and alcohol use in relation to MASLD outcomes to provide more comprehensive risk factor profiles. Quote, the more we can understand about the drivers of the disease, the more we can identify those most in need of the interventions and prioritize our resources for enhanced outcomes, says Thoreau.
I wonder if alcohol drinking is a major cause of this because that affects the liver.
Yeah. I mean, they mentioned diabetes, right?
Yeah.
So I don't know. It's
diabetes too. Yeah.
Yeah. So I mean, any of that kind of stuff. I mean, let's face it. I mean, I'm not banging on alcohol or anything like that. If you want to drink, that's it's legal to do that. But it's there's nothing healthy about it. So it's like indulging in drugs or smoking or whatever. I mean, it's not good for your body.
Yeah, it's not.
But again, it's totally up to you what you want to do. So anyway.
All right, folks, thanks for joining us. We'll catch you tomorrow.
Yep. Have a good one. Take care. Thank you.